Good day. I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. On behalf of Padma Clinic and Nursing Home, Chennai, as well as on behalf of Lions Club of Madras Excellence, and as a part of a continuing medical education program, today to commemorate the International Nurses Day, I'd like to elaborate on what exactly is a quality service by a nurse. As a physician, neurophysician and neurosurgeon, and having practiced in the medical field for more than 40 years, and this is the advice which I have to give to my sisters and in the nursing field. Quality service is a measure of how a nurse understands the patient's needs and fulfills their expectations. This is exactly what is a quality service. A nurse is expected to render quality service to every patient. Very, very important. There are certain points. Now, suppose the nurse is in a ward. We take that as an example. How do you render a quality service to the patient? As soon as the patient arrives into the outpatient or in the emergency, and after which the nurse in the ward, they get a call that the patient is being transferred to the ward. So the quality service of a nurse in the ward starts then. Before the arrival of the patient, they should make the following things ready. As far as which is the room should be seen to be that it must be kept clean. The restroom should be kept clean. See that TV, air conditioner or whatever it is, what is available in the room should be working. At the nurse's station, you must keep the BP apparatus, the thermometer, stethoscope, the initial assessment forms, and all the proper papers for documentation should be kept ready in the nurse's station, and also proper hand hygiene to be done. The second one is, as the patient enters into the room and the patient is made to lie on the bed, and as the nurses enters the room, before entering the room, please knock the door. Very, very important. And as the door is open, introduce yourself with a smile and also wish the patient it is good morning, good afternoon or good evening or namaste. The patient should feel very happy and safe when they see that smile and the way the nurse wishes the patient. Because each patient or every patient has got varied problems. So they come into the hospital with lots of mental tension, not knowing what the outcome is going to be of their ailment. And when they see and they are being received, they feel very happy. The nurse should then give a proper orientation of the facilities in the room. Then the identification badge for the patient, and the nurse should also say this is the call button where you can press, and then immediately at the nurse's station we'll come and attend to you. Then their valuables have got to be kept safe, they have to be told. And the switching on and off of air conditioner if there is, TV facilities if there is, then the restroom facilities, food services that are available in the hospital, the pharmacy services, how can they go in for, and the doctor's visiting hours, and also the visiting hours of the visitors will have to be told. The nurse will also have to tell them about the nurse shift timings, what exactly the duration they'll be working and who will be the next nurse. Then the billing and insurance, if they have any doubts, they can told at which floor and where they can attend to the office. Seventh one is after this, do the initial assessment with the permission of the patient. In case the patient is tired, it can be done, but it should be done within an hour. You can also get all the other details from the patient's attenders. Next, record the vital signs immediately. Inform the concerned doctor about all the details of the patient. The nursing care plan then is being made, and when the doctor comes, nurses should greet the doctor. In the process of initial assessment plan or anything, if you find the patient is violent or restless and the patient has to be restrained, see that you get a signature, a consent from the patient's attender who is there, as well as you seek the help of the ward attenders, if essential, the security to restrain the patient. Thereafter, one can start the examination and treatment can be given. So the 12th point is the nurse, of course, should greet the doctor as the doctor walks in. Immediately take appropriate documents of the patient and accompany the doctor. Very important. The 14th point, tell the doctor all about the progress of the patient, what has been recorded by the nurse. And the 15th point, as the doctor gives instruction, the nurse should write down in the document of the patient as well as in the nurse's notes. As the doctor leaves the ward, say, thank you, doctor. 17th, then carry out the instructions of the doctor promptly for the benefit of the patient. And when the instructions are being carried out, what are the most important thing the nurses should look into is to see that medication errors are being prevented. Follow the rights of the medicine being given. The right patient, right medicine, right dose, right time, right route, right recording, right assessment, right education, and right evaluation. All these are very important. Even the right recording is very important. So, right patient, right medicine, right dose, right time, right route, right recording, right assessment, right education, and right evaluation. Be sure to read the labels of the medicine at least 3 times before giving the medicine to the patient. Prepare the medicine in a well-lighted room and check the expiry date of the drug before giving it to the patient. All these form part of the quality service. Be careful of the not neatly written medicine order. Suppose you find the medicine order you are not able to understand, immediately contact your duty doctor or the consultant himself or herself and see that you clarify it before giving it to the patient. When you have doubt, check the order of the medicine with the doctor. All nurses should read the medicines. In fact, they should thorough themselves. They should read the medical literature, not at that particular moment of time, but subsequently in their leisure time, they can actually read about those medicines which are being given to the patient. Double check all the calculations, even simple calculations, drip rate, within how many hours it has to be given, all those things have got to be calculated. These all form part of the quality service to the patients. All the records as per the NABH guidelines, the National Assessment Accreditation of Board of Hospitals, guidelines should be completed daily on a day-to-day basis. When the nursing work time is over, you must introduce the next nurse to the patient before leaving the ward. This is again very, very important. Is again form part of a quality service. When your duty time is over and when you are handing over to the next nurse who is in charge, introduce them to the patients so that the patients will be aware whom they have to call when there is a problem for them. Then hand over all the patient details to the next nurse. When handing over, the following things should be told, especially the diagnosis, the comorbidities, the medications, the allergies, and the doctor's latest instructions. Never criticize a patient, even if he behaves angrily, when you are handing over to the next nurse at the nurse station. Don't do that. When a patient is being discharged, You should instruct the patient on the medication management, the meal management, the activities of daily living, rehabilitation, whatever that has been prescribed by the doctor has to be explained in detail to the patient before he or she leaves the ward. And all the above should be done in a very patient manner. When patient calls immediately to attend the patient, immediately, suppose the patient rings a button and calls, immediately go there and attend to the patient to solve his or her problems. One should respect the patient, be very polite and talk affectionately. Also respect the family members of the patient. This will reduce the patient anxiety and fear. When you say respect the patient, that means you are respecting the dignity of the patient. Every human being, there is an inherent quality of every human being that they have to be respected. So that is exactly what we are doing there. You are respecting the patient. Be very polite and talk affectionately. Also respect the family members of the patient. This will reduce the patient anxiety and fear. And that's indeed a quality service to the patient. Patient should be safely discharged from the hospital with a proper discharge summary. This is the 35th point. The next, the stay of the patient in the hospital should be a very comfortable one. Whatever may be the illness, what the patient suffers, but the stay has to be made very, very comfortable so that the patient will have a lot of relaxation. The entire staff of the hospital should behave very kindly to the patient and the family members, right from the security to the receptionist, the front office, nurses, doctors, ward attendants, so on. One must respect the dignity of every person. That's what I told you, the inherent value of every human being to be respected. So that has got to be followed. 39 is, at every moment, patients should feel that they are being respected and given the most loving care. And that is what the patient anticipates and expects. Very, very important as the patient is being wheeled or as being walked into the hospital. If the patients are fully satisfied, that means the hospital has given an excellent quality service. Very important. If the patients are fully satisfied, that means the hospital has given an excellent quality service. Nurses must also find out how innovative methods can be used to give treatment to the patients. These are indeed the most important valuable points for every nurse, in fact, to render quality service to the patients. Thank you very much.